This video supplements Chapter 3 in your textbook and deals with the skeletal system.
When talking about the human skeleton, we can think of it in two categories. The axial skeleton, which contains the skull, vertebral column, sternum, and ribs, supports the body and protects the central nervous system, or the CNS. The other category is the appendicular skeleton, which includes the bones of the upper and lower limbs, as well as the shoulder and hip girdles. These girdles join or articulate the axial skeleton to the appendicular skeleton at joints. There are three main types of joints: fibrous, cartilaginous, and synovial. Fibrous joints allow no movement. Cartilaginous joints allow little or no movement, and the synovial joints are able to move freely. Synovial joints allow the skeleton to perform movements in various directions. Each movement occurs at the axis of rotation, which is an imaginary line that forms a right angle with the plane of movement about which the joint rotates. Joints can have 1, 2, or 3 axes of rotation. Movements of synovial joints include flexion, extension, abduction, and adduction. During flexion, there is a decrease in the angle of the joint. In extension, there is an increase in the angle. For example, the up phase of a bicep curl produces elbow flexion. The down phase is elbow extension. There are two other types of flexion that occur only at the ankle joint. Dorsiflexion involves pulling the toes back towards the shin. Plantar flexion involves pointing the toes towards the floor. Abduction is movement away from the midline, such as lifting your leg out to the side. Adduction would be the leg coming back towards the midline. When all four of these movements are done together, it is known as circumduction. The shoulder is a great example of this. Think about performing an arm circle and how it incorporates all four of these movements. Rotation is the movement of a bone around a longitudinal axis, and it can occur internally or externally. From anatomical position, the femur turning in would be internal or medial rotation, and turning outward would be external or lateral rotation. When the wrist or forearm rotates out, so the palm is up, it's known as supination. The opposite movement, palm down, is pronation. Certain joints have actions that are particular to just them. For example, the scapula can elevate or move to a superior position and depress or move to an inferior position. Another example involves the subtalar joint, which is found in the foot. This joint can move into inversion and eversion. When the ankle rolls out and your weight goes into the outside of your foot, that's inversion. When the ankle rolls in and the outside of your foot comes off the ground, that's eversion. The movements that we just discussed occur in planes. The sagittal plane divides the body into right and left halves. Imagine that your client was divided in half with a right and a left side. Flexion and extension occur in this plane. The frontal plane would divide the body into a front and a back half. Abduction and adduction occur in the frontal plane. The transverse plane would divide your client in half, creating an upper and lower half. Rotation occurs in this plane.